So today we're going to talk a little bit about sciatica. If someone comes in to see you and they say, I've got sciatica, test for it first. So a couple of tests you can do. The best one I know is the slump test. Can you take a seat for me, please? Okay, so you know the sciatic nerve runs all the way down, well, it exits out of the lumbar vertebra, okay? The nerves all start at the top and they feed the body. The sciatic nerve exits out of the lumbar and the sacral vertebra. So you need to tension it to see if there's a pain response. Okay. Can you put your hands behind your back? Okay. Just drop your head. So we start to stretch the nerve. Okay, and if they say I've got sciatica down the right leg, well, we stretch the right leg and we try and get a response out of the sciatic nerve. Okay, so full knee extension and then pull the toes up. If someone's really got sciatica, you don't even need to do that. As soon as they lift their leg up, they will say, I'm getting pain in my butt, in my hamstring, in my calves. Okay, so a couple of things we need to check for. You know the sciatic nerve exits out of the lumbar vertebra, okay, and we flex a lot, right? If you flex a lot, you know from previous posts, you will squash the disc, you'll get a posterior herniation, okay, and what's the disc going to push on? Sciatic nerve. Okay, so first test. Can you stand up to me, please? Right. We check to see if people are crushing their discs. So I put my fingers on the TL junction, okay. If the two back muscles, energy lines, okay, are hard, in this case they aren't, but if they are hard, I ask my patient to lean back slightly, lean back until they soften. If they do soften, they were standing in flexion. So that's the first thing. Someone with sciatica, make sure they aren't crushing their discs. Okay, next test. You know the lumbar spine is not designed to rotate. Okay, so we need to check for rotations. If it's constantly rotating, it's causing inflammation, you can quite easily get irritation of the sciatic nerve. Okay, let's test. Can you lie on your back, please? Maybe on this mat. Okay, a couple of ways to test for rotations. Okay, just remember, that is the hip. That's not the hip. That's the pelvis. Okay, so I'm not looking here. Relax. Okay. Not too fast, not too slow, this sort of speed. You let your leg lower to the ground and come back up again. Okay, so that's a big rotation. And back again. Right. Someone with sciatica, if they've got a rotation, I could be wrong, guys, I'm just giving you things to check. Stop the rotation, because they lack pelvic stability. How do you do that? Easy peasy. Don't let your pelvis rotate. Do that again. Keep it down. Keep it down. Good. The brain's figuring out what needs to fire, not me. Up again. Keep it down. Fine. Okay, and these are all in other posts. So, second thing, you identify rotations. Right. Once you've corrected the standing posture, okay, you've checked for rotations, you then need check where the sciatic nerve is being trapped. Okay, it's not always the piriformis. That's a very old-fashioned way of thinking. Okay, it's rare to have piriformis syndrome. Right. So you know the sciatic nerve exits out of the lumbar, and you also know that the root of the mesentery, okay, which feeds the small intestine, okay, it's responsible for getting nutrients out of the food. Okay, it sits. This is the right hand side. Don't mind if I can do this. Thank you. Okay. So there's your belly button. There's your ASIS. You know that halfway in between the belly button and the ASIS is the ileocecal valve. Go a little bit further up and you've got the root of the mesentery. Okay. So it's up to you how you work that. This is not a blog of techniques, but you can come in, gently loosen, do deeper work. Okay. and then recheck the slump test. Does it feel better? If it does, that's where the sciatic nerve was impinged. Okay? Secondly, can you turn onto your stomach for me, please? Okay. It can be impinged by the glutes, the whole complex. Okay, so what you can do, whatever technique you guys choose to use, okay? You can loosen, yeah, do all your lovely soft tissue work, okay? Recheck, test again. Hamstrings, you know the sciatic nerve runs down the hamstrings and it feeds the calves, yeah? So you can do soft tissue work. Again, totally up to you what you do. Recheck. Has it helped? If it helped, that's where it was stuck. Okay? And then you can go into the calves, for sure. Lateral and medial. Okay, and again, recheck. One other test that I get from Brian Mulligan, so Mulligan mobilizations, very interesting actually. Can you lie on this side for me, please? I'll make you comfortable. Okay. If Anya keeps her legs straight, she does this, then she's got sciatica. This, with the head flexed, okay, will elicit that pain. Okay, I've got it. So what do? There's one place we haven't covered, and that's the lumbar spine. So, from about L3 down to the sacrum, you can either push, yeah, okay, can you bring your leg forward again, please, and back. If she says, I don't feel that anymore, do that, maybe 30 times. You mobilize the lumbar spine back into centration. Or, what can you do? You can pull, yeah, and yeah, can you bring your leg forward, thank you, and back. Right, doesn't always work, but there have been cases of success with this, okay? Basically, you're just centrating the lumbar vertebra, and whatever was impinging on the sciatic nerve doesn't impinge anymore. And it's either a push or a pull. Okay, break.